guys, my name is Nay. Welcome to the channel and the video. In today's video, we'll be talking about diabetes education for the patient. All of this information is from reliable resources. I will put the links down in the description box so that you can go back and look up all this stuff again in your own time. If this is something that you're interested in, learning about diabetes education for the patient, very simple terms, easy to understand. Stay tuned, keep watching. Okay, so first thing is, why do I feel that we all need to be informed about diabetes and how it affects a person's body, how to live well if a person has it? Well, according to the CDC.gov, these are 2020 statistics, 34.2 million Americans have diabetes. That's 1 in every 10 Americans have diabetes. And 20% don't even know they have it. When you look at, there's so many health factors that come into play when a person has diabetes. You know, if you're managing it well, you can have a healthy and a good life. You can, live and thrive. But if you don't know it and you're not managing it well, it can cause damage to your entire body. Lifelong damage to some of your organs and your body systems. So it's important to know about it, be informed about it, and so you can make well educated decisions for your health, or even just to be able to help others who have it. Diabetes. There are different types of diabetes. You have pre-diabetes, and then you have diabetes type 1, type 2, and also gestational diabetes. So let's go through the terms of what that means. So gestational diabetes is just when a woman is diagnosed with gestational diabetes when she's pregnant. So if a woman is pregnant and she didn't have diabetes before, but she has diabetes because she's pregnant, then that's gestational diabetes. 50% of women who are diagnosed with gestational diabetes will develop type 2 diabetes later on in their life. So it's important for them to develop healthy habits and that they can avoid, having this type 2 diabetes later on in life, because that's a risk factor. If you have gestational diabetes, you're at a higher risk factor of developing type 2 diabetes later in life. Pre-diabetes. What is pre-diabetes? Pre-diabetes, also termed, sometimes people refer to it as impaired glucose tolerance. It is when blood sugar levels are high but not high enough to be considered type 2 diabetes. They can become type 2 diabetics in 10 years. So it's kind of like pre-diabetic can be like the precursor to type 2 diabetes if a person doesn't manage their lifestyle, have healthy lifestyle. So diabetes, you have type 1 and type 2. So diabetes simply means, that you have high blood sugar levels. You have high blood sugar levels, simple as that. And type 1 diabetes, also termed juvenile diabetes, this is typically diagnosed in a child. So, in a child before they reach that adult age, if they have diabetes, it can be termed in juvenile diabetes type 1 in childhood. So basically, why does this happen? What's going on with this? Destroyed pancreas cells cannot produce insulin. So basically, your pancreas is an organ in your body that produces insulin to balance your blood sugar levels. So what happens is you eat and your blood sugar levels will go up, and your cells will use the food that you eat to for energy for the body. But when a person has diabetes, their pancreas, or type 1 diabetes, their pancreas is not producing enough insulin to bring those blood sugar levels down. So their blood sugar levels remain high all the time. They typically will have to receive insulin because their pancreas isn't making enough insulin. So they have to replace that some way and they'll have to receive insulin along with some of the treatments. They'll have to receive insulin along with maybe other medications from the doctor's discretion, lifestyle changes, lowering stress, weight loss if needed, medication, low carb diabetic diet. Type 2 diabetes. Type 2 diabetes, also known as adult onset diabetes. What's up with this? Why does this happen? So in type 2 diabetes, the pancreas doesn't produce enough insulin, or body tissues cannot absorb the insulin. So in type 2 diabetes, adult onset diabetes, the pancreas is making insulin, but sometimes it's not making enough, or the body tissues cannot absorb it for whatever reason. And also there's different studies on, if you don't have a healthy weight, all that extra fat and stuff like that, it makes it even more resistant, your body even more resistant to to absorbing insulin to, you know, as you get older and things of like that nature. So that's why there's kind of a link between obesity, being overweight, and things of that sort. There's some type of link with it to type 2 diabetes, which is why if you're eating healthy, you know, losing weight, maintaining a healthy weight, making lifestyle choices, it can benefit you in so many ways and help stabilize your blood sugar along with taking your medication and stuff like that on time. So let's talk about what are some signs, you know, if a person is experiencing diabetes. What are some signs you know, you would think, oh, maybe you need to check your blood sugar levels or discuss this with your doctor. Okay, these are some generic signs that we'll talk about. Increased thirst, thirsty all the time. Increased urination, going to the bathroom all the time. Peeing a lot. Increased hunger, seem like you're hungry all the time. Fatigue, like you're just tired. And blurred vision. With those high sugar levels in a person's body, it can start to mess with the small blood vessels in the eye, so it can start to mess with diabetic vision problems. For type 2 diabetes, adult onset diabetes, some signs and symptoms: poor wound healing, uncontrolled nerve damage. You know, once it gets to a point where it's uncontrolled and a person isn't, you know, taking their medications and, you know, doing what they need to do to keep their sugar levels healthy in an adult, it can lead to poor wound healing, nerve damage called diabetic neuropathy, where they'll have tingling and you know, nerve damage and stuff, where it's their hands and their feet maybe can't, you know, numbness and tingling, can't feel as well with the nerve damage in the hand, feet, and of course in their eyes, blurred vision. So those are some kind of signs and symptoms to look for. You know, if you're having anything like that, you might want to make an appointment with your doctor and get yourself checked out. Let them check your blood sugar levels, let them check your A1C levels and things of that sort. So how is diabetes treated? For the most part, you know, diabetes, it can all, you know, they can be treated the same, and of course it's up to, you know, your doctor's discretion based on your health, age, what other coexisting conditions, diagnoses you have. You know, but they're typically generally the same, that you can have these, you know, general treatments. So lifestyle changes, lowering your stress levels, you know, quitting smoking, you know, making sure if you are drinking that you're not unhealthily drinking, you're not, you know, abusing alcohol. Lifestyle changes, you know, just healthy lifestyle change. Weight loss, if you are overweight, losing weight can help you manage your blood sugar levels. Taking your medication properly. So whatever medication that you and the doctor, you know, come to an agreement on what is best for you, take your medication properly so that you can manage your your blood sugar levels. And also a low carb diabetic diet. Those are some things, treatment options that, you know, typically will be, you know, given or set up to a person who has diabetes. And just for the record, there are tons of medications, anti-diabetic medications, tons of medications. And typically in type 2 diabetes, because the pancreas doesn't produce enough insulin and body tissues cannot absorb it, they're going to get anti-diabetic medication to, you know, to bring their blood sugar levels down. How is diabetes diagnosed? How is it diagnosed? Typically, a physician or provider will, you'll have your fasting sugar blood level tested, or your A1C blood test completed. And for fasting blood sugar test, is when you fast for 8 hours and then you test. And say, for instance, you take a fasting blood sugar level and your blood sugar levels are still high and you hadn't even eaten in 8 hours, then they will typically diagnose you with diabetes. So, who are some doctors that you're going to see if you have diabetes? You'll see a primary care physician. They can manage your diagnosis and your health. A pediatrician, if a child has type 1 diabetes, they'll be seeing a pediatrician who can manage their health. Endocrinologists, they are doctors that work with different hormones and things like that in the body, all of the endocrine system. And you know, diabetes is an endocrine system disease, so seeing an endocrinologist, you know, they'll be able to help manage that disease as well. Sometimes also a nutritionist, just to get health advice if you need tips on healthy eating, what it looks like having a diabetic diet. You always bring those concerns up to your doctor at your appointment, and they'll address them for you. You know, predispose a person to diabetes: being overweight, having a sedentary lifestyle, 45 and over 45, family history, which is genetics, being a person of color, a minority group, having high blood pressure, having high cholesterol issues, all things that can kind of put you at a risk category for diabetes. So what are some things that you can do to kind of combat those? You know, say for you can't control your genetics, you know, you can't control some things of that sort, but things that you can do, you know, maintain a healthy weight, have a healthy lifestyle changes, quit smoking, you know, limit your alcohol use, manage your other health diagnoses, taking your medications for all of your other health diagnoses like you should, take your medication for your diabetes like you should, exercise, have a low sugar, low carb diet, and of course if you're taking medicine, take your medicine. And I know some people out here, some people, they're like, oh, I'm gonna lose weight, so I'm not gonna take my medicine. I'm gonna lose weight and I'm gonna exercise. You know, this is a medical condition, so you're not gonna lose the weight that you need to lose by tomorrow. You know, so you need your blood sugar levels to be maintained now. So, you know, that's good. You make those goals to lose weight, eat healthy, but in the meantime, take your diabetic medication so that it can manage your blood sugar levels, because if you have high blood sugar levels and you're not maintaining it, it can lead to all kinds of issues that we talked about. You know, vision problems, diabetic neuropathy, nerve damage. It can damage your liver. Okay, it can damage your kidneys. You know, if you ever heard of somebody who, you know, had uncontrolled diabetes and they ended up on dialysis, you know, it can damage so much and so many things in your body. So you definitely want to manage it the right way. So take your medications, eat healthy, exercise, lose weight, maintain a healthy weight, maintain healthy lifestyle choices, and you'll be good. I'll leave you with some more facts from the CDC 2020 statistics, because I like facts and they're good to know. 88 million people in America have prediabetes. 1 in 3 do, you know, that's like 1 in every 3 person, and 84% of the people don't know it. And of course there are higher cases of diabetes in minority populations, so African American, Hispanic, Latino. There are more cases of diabetes in you know, individuals who are people of color. For adults diagnosed with diabetes, 15% were smokers. Out of this data, 89% were overweight, 38% were physically inactive, and then out of 37% were diagnosed with chronic kidney disease. So this is some big stuff, and it can impact your life negatively if you don't manage it. So go to the doctor, get your routine preventative checkups. Get up to check your blood pressure, your blood sugar, your cholesterol checks, get your health screenings annually. Age appropriate screenings such as mammograms and colonoscopies at the age appropriate time. See your doctor, ask them questions if you don't know. Pay attention to your body and treat your body well. You only get one body, so you want to treat it well. So I hope this information was helpful to you. I'll leave the links for the resources for this in the description box of this video. Do your own research. If you have questions, ask your doctor, ask your nurses, and research. Treat your body well, be healthy. You can live a healthy, full life with diabetes, and you can also manage it and maintain it, and eat well and healthy so that you can have, normal, stabilized blood sugar levels. So that is the goal. So references: cdc.gov, American Diabetes Association, google.com, and choosemyplate.gov. Go to those websites, research this topic, and learn about this so that you can take control of your health, and just be aware so that you can make better decisions, educated decisions that will benefit you and your family. All right, love y'all. Drop any questions you have below, and let's just be healthy. All right, peace and blessings.